Hello?
Hi, this is Jane. Is this telehealth?
Yes. Hi, Jane. How are you?
Uh, I'm kind of okay. I have I have a wound on my leg,
Oh,
and
okay.
I'm getting a bit concerned because it's a bit swollen and it's very painful. It's also like when I touch it, it's like super hot.
Oh, okay. Jane, can we start off with your birthday first?
Yeah, my birthday is June 30th, 1993.
Perfect. And do you mind telling me where you're located right now?
Yes, I'm located in the rural community called Sage.
Okay. So, June, you were telling me that you have a wound on your leg. Is this a new wound that you've had, or did you have like surgery, or like how did the wound start?
I fell. It started off as like a kind of like a little bit of a gash on my leg,
Uh huh.
and I just put a bandage on it. It
Mm-hmm.
was looking good for a bit, but then now it's just lately it's just been like increasing in size. It seems like it's swollen, and
Mm-hmm.
it's just painful.
Okay. So, June, you're telling me that it's warm to touch and it's painful when you touch around it?
Yes.
Mm-hmm. And when you look at it, is it red?
It's really red.
Mm-hmm.
When I take the bandage off, there's like some nasty white stuff on there.
Oh, okay. June, do you have a family doctor?
Yeah, I do have a family doctor, but they're really far away, so we usually communicate via Skype or
Mm-hmm.
yeah.
June, I suspect that you might have an infection in that leg. You've told me that it's hot when you touch it, that it has some drainage, and that it's hurting you and it looks red and swollen. So I'd really advise you to connect with your doctor through the phone if you can't get to your doctor, and to speak, and he might be able to prescribe you something. And in the meantime, are you taking anything for the pain? Maybe like Tylenol?
No, I haven't been. I try to take I try not to take a lot of
Uh
medication,
huh.
but I'll take your advice and start taking some
Mm-hmm.
Tylenol.
You could also try giving the site a rinse with water. So when you're in the shower, you could have the water a little bit warm, or you could just be sitting down if it's easier for you, if you can reach your leg that way, and pour some warm water over it. You can also clean it. Do you have even just like a mild soap if you don't have anything else? Do you have like a first aid kit with you?
I don't have a first aid kit, but I'm sure I can get it from the grocery store.
Uh-huh. And sorry, and I forgot to ask you, when did you actually get this gash? How long has it been?
It's been like 5 days.
5 days? Okay. So I'm still thinking that you have an infection. So, June, I say you give it a nice clean with whatever you have there. So that means just running it over with some water and putting a clean bandage. Or do you have any gauze with you?
I got bandages. I don't got gauze, but
Okay.
if I go get a first aid kit, I'm sure it'll have some in there.
Yeah, perfect. All right, June. I like that idea. I do want you to connect with your doctor, because I think it's something that a doctor needs to deal with at this point. And yeah, and just making sure it's clean. And then, do you have any other questions?
Yeah, you said when you're cleaning it, just clean it with warm water and mild soap. But do I just like scrub the area? Like how do we clean it?
No, I would advise not scrubbing the area because you can actually aggravate it. Because you'd mentioned that it actually hurts right now, right? So I think that if you take anything too abrasive to it, you could actually like hurt the wound bed, and you might introduce maybe some new bacteria to the area as well. So I just say, just having that water, just run it over. If you can run your water, just your leg right under like the faucet of the tub, if you have like a sit-in tub, just have that water run over the wound, and then the discharge can just be kind of drained off to the side, and then have that soap to clean it.
Okay, that sounds like a plan.
Perfect. Thanks so much for calling in, June. If you have any more questions before your doctor's appointment, you can give us a call.
Yeah, for sure. Thank you so much.
Thanks. Okay, bye bye.
Bye bye.